Now let's discuss diagnosis according to Qi or blood stagnation. Blood should flow freely and unhindered throughout the body. Blood can stagnate for a variety of reasons. Blood and Qi have an extremely close relationship, with blood being dependent on Qi for its movement. This means that Qi stagnation can result directly in blood stagnation. Qi deficiency can also be a cause of blood stagnation when Qi lacks the strength to circulate and spread blood. In this way, blood deficiency can also be the cause of blood stagnation. The movement of blood can also be blocked by phlegm and by physical traumas, including surgery, because when there's physical trauma or surgery, blood will leave the vessels and will no longer be circulated by Qi and will therefore stagnate. Heat can condense blood so that it becomes sticky and clots. Cold can freeze and congeal blood. Just as phlegm and dampness have none of the moistening or lubricating qualities that Jinya has, blood stagnation has none of the moistening and nourishing qualities that physiological blood has. In fact, stagnant blood blocks the passage of Qi and blood in the coolie and thereby prevents fresh, nutritious blood from circulating to or through an area. This means that some of the symptoms and signs of blood stagnation and blood deficiency can be very similar. There is, though, a significant difference between them, which is that the signs of blood deficiency will be limited to a very localized area and will not be systemic, as is the case when there is blood stagnation. In China, many doctors focus on treating blood stagnation in elderly patients. This is because blood stagnation is part of the aging process, and blood stagnation is often a consequence of most chronic imbalances. The consequences of blood stagnation can often be observed in elderly patients. Their movements can be stiff and painful, and they often have visible signs of blood stagnation in the form of spider navy and visible purple capillaries in the skin. Like phlegm, blood stagnation is something that is very common, but many people overlook it when they diagnose. This is because, like phlegm, the symptoms and signs that are described in Chinese textbooks are slightly oversimplified and gross. In reality, a diagnosis of blood stagnation will be based on many small signs and symptoms that are less tangible and thus more difficult to spot unless you consciously search for them. One of the main symptoms that Chinese textbooks define as being characteristics of blood stagnation is pain that is stabbing, sharp, or piercing in character. The pain will be fixed, localized to a specific place, and will not move about. The pain has this character because blood stagnation creates a physical blockage that prevents the movement of Qi, blood, and Jianye. This results in Qi accumulating in a small and limited area where it cannot circulate. Where there is stagnation, there is pain. The pain in blood stagnation is unlike Qi stagnation pain. Qi stagnation pain is more fluctuating and less fixed. When there's Qi stagnation, there will be stagnation in a much larger area, but Qi will be able to move about within this area. It means that the pain is more undulating and spasmodic. The pain will also be able to move slightly from place to place. Qi stagnation will also manifest with a more tense or distended sensation. Blood stagnation can manifest as physical accumulations, lumps, or hard knots in the muscle or tissue. This is because there is a stagnation of physical substance. Fibroids and myoma are examples of blood stagnation, but it is important to remember that phlegm can also create lumps in the tissue. This is because phlegm is also a physical substance. The difference between lumps and accumulations that are manifestations of blood stagnation and phlegm is that blood stagnation accumulations will be harder and have more clearly defined but rougher edges. Phlegm accumulations are less clearly defined and smoother. Furthermore, blood accumulations will be more painful. The menstrual cycle is totally dependent on blood flowing freely and unhindered. Blood stagnation will therefore often manifest with a disruption of the menstrual cycle. The cycle may be longer because blood does not flow freely and thereby stagnates in Chiang Mai. There will be dysmenorrhea and the menstrual blood will be dark and clotted. There can also be heavy or extended bleeding, with the bleeding continuing for longer than the normal for 4 to 6 days. Blood stagnation can be a factor in bleeding anywhere in the body because stagnated blood will create a blockage in a vessel. This will lead to an increase of pressure in the vessel because blood and Qi cannot get past the blockage. Eventually, the pressure becomes so great that the wall of the vessel ruptures. And when there's bleeding, whatever the cause, it will itself become a further source of a blood stagnation. Because when blood exits the vessels and channels, it is no longer circulated and governed by heart qi. It will then stagnate and further disrupt the movement of qi, blood, and jinye. Thank you for your attention.